Okay, I've been on my live. I got to make sure everything is lined up because I'm streaming from my phone, but I'm looking at the comments on my MacBook. So I'm going to give you 15 healthcare jobs that. So I want to really discuss this RN versus LPN thing because, it's getting a bit out of hand and it shouldn't be that way. Okay, give me 1 second to refresh my page to make sure. Okay, we live. We believe in a future where every person has the opportunity not just to get on, and I want to really chime in with you guys to get information on your perspective to see if I'm tripping or not. Okay. Now, make sure my audio is intact. I'm gonna wait for a few people to get on here before I really start going at it. But we just need to discuss this, you know, this RN, this LPN or LVN, which one is better, who does circles around who. And it's not really even about that in nursing. I mean, it's different levels to nursing, all the way from a nursing assistant or certified nursing assistant, all the way up to CRNA. Okay. So people need to really stop this. I've been an LPN for 30 years and I can do circles around a new RN. Of course you can. This is a brand new RN. You have 30 years of nursing experience, and this is a novice. That's not even a comparison. Now, if there's anybody that's watching, whether it's during this live feed or whether it's after, because I'll keep this live up so you can see it if you missed it, put in the comments, if you're in healthcare and what your profession is. Of course, I'm nurse savvy, but I'm a registered nurse. I never was a LPN. I went from phlebotomy into nursing. Um, I did maybe a tech role for a couple of weeks just to get into the ER and then pass boards. And then I transferred over to the RN role where when I started off, there were no LPNs in the hospital. They were only in skilled nursing facilities, long-term care, things of that sort. They kind of phased them out of hospitals, but now they're starting to bring them back. So it's awesome to see LPNs working with RNs, but that's in the hospital setting, but I don't think it needs to be any type of comparison regardless. Okay, let me see. Let me see. Lincoln, hello from South Africa. Nerdy, no, I don't think you're the only one here. And you said no, you're not. What does that mean? No, you're not. What? Okay. And if you're looking at my face and you've already been on my channel before watching my videos and you're not subscribed, please do so, because why not? I mean, it's free to do it. Pretty much if you see my videos, you'll probably see more. So why not subscribe to the channel? Because like I mentioned in the other live, it's over like 2 million people that watch my channel. And of course I don't have 2 million subscribers. I mean, when it comes, it comes. But if we're already engaging with each other and you're watching my content, just subscribe and make sure you give me a like on this video. Okay. We are all here. Hello, Matthew. Do you enjoy married men? Mike, okay, so I do enjoy my married man. I do. But no one else's. I don't play that. All right. Anybody else want to say something before I get into it? What I am discussing is the RN versus LPN and how it needs to stop. If there are anybody in the medical field, comment your comment your profession, whether you're working the bedside as a CNA or a tech in the ER, if you're a licensed professional nurse or licensed vocational nurse, registered nurse, NP, MD, PA, whatever it is that you are in healthcare, let me know in the comments. Or if you're a nursing student, if you're a nursing student, just comment, say, hey, I'm in nursing school for this, whether it's LPN, RN, NP, whatever it is. If you're going to get your master's for education, or anything like that. So I want to make sure that, let me see. Okay, answer. Put the question in the comment. Let me see. I love watching your videos. Thank you. You're welcome. Just passed my RMA. So is that registered medical assistant? If so, congratulations. If it's not, correct me in the comments. Okay. All right. So somebody is gonna get muted because they sitting here putting stuff in the comments, and that's unnecessary. So we're gonna just report that right on out and go from there. So, okay, perfect. Okay. So if there is anyone, what? Okay, some people just be putting anything in the comments just to be seen. So I'm not repeating that. Anybody else in the comments? Is about 100 people in here. Hopefully everybody is liking the channel, especially this live, as well as you're already subscribed to the channel. If not, feel free to do so right now, because I know you've probably already seen my face in some of my shorts or maybe my other live streams. So I'm going to get into it because, let me see. What's the question? You said you have a question that's bothering me. What's your question before I get into it? Right, I agree. Stop the unnecessary comments. Ariana, 33 years. Jennifer, hello. Okay, I believe we all are valuable and we just work in different capacities. I work in geriatric dementia. Oh, nice. Let me see. Thank you so much, Zoe. Let's see. Anybody else want to throw something out there before we get into, I'm trying to make sure that I'm comfortable. This back pillow is going to help me because I'm going to be sitting here talking to y'all. So, Zoe, okay. Just misspelled. Okay, Zoe. Thank you so much, Zoe. All right, if you wanted to put a question in there, feel free to do so, and I will check it. If it comes after I start talking, I'll check it in between. So with this, a lot of videos that I've posted, there are hundreds of comments that I see. It used to be thousands of comments, especially when I had my videos that were like millions of views or whatever. And the few that stood out to me that I wanted to address was, I've been in this role for X amount of years, and there's a new so-and-so. Okay, I think prime example, let me think if I remember it correctly. It was a LPN that has been a LPN for maybe over a decade. And she mentioned that she could do circles around this new RN. That needs to stop, because we're in nursing. It's a team from the CNA to the LPN to the RN, right? It's a team, and then the doctor. Or if it's CNA, LPN, RN, NP, doctor. We're all there for the patient. So, does it make you feel better that you can run circles around a new nurse? Okay, pat on the back for you. But if there's something that you need from that new nurse, wouldn't you want to help that person to kind of figure out what's going on? Would you want to kind of be there for them? Because I'm sure when you were a brand new nurse as an LPN, you had somebody that was there for you. Nobody just goes without somebody being there. That's why they're preceptors. And the funny thing is, it doesn't make you look good when you say I can do circles around, I'm an LPN and I can do circles around this new RN. It just seems like you're bitter. So um I don't know how to reduce that, to be honest. You may have to talk to a medical professional because nurses don't know everything. And I'm not sure if I can help you with that, Emmanuel. Okay, the nursing field has gotten messy, cocky, competitive, and cutthroat. And a lot of these young women that went to school for nursing just wants a bag. Oh, wants a bag. And they have no care and compassion. They pretend to. Neek, unique. I agree with you to a certain degree. Now, what I will say, there are a lot of people that get into nursing. And I mean, Neek, unique, are you in the medical profession or are you a nurse? Let me know, because nursing school is not easy, especially RN. You got to go through 2 years of all of this stuff. You got to go through clinicals, you have to do your testing, and it's not for the weak. So, a lot of people may say, oh, well, I'm going to go and get my LPN because I can do a year of school and then test and then start working, right? And the majority of the LPNs that I know, they started off in a nursing home or long term care, skilled nursing facility, something like that. Thank you so much. And what's what's terrible is if you want to get into the field of nursing to get more money, at least have the attitude and the compassion to care for patients, because you're going to come across, and I've shown videos of people that beat on their nurses. It was a YouTuber that y'all brought to my attention, that because I knew she looked familiar, but I wasn't sure if she was just somebody that I saw on Instagram or TikTok or something like that. But she's a content creator with multiple kids, and she admitted on a podcast that she punched a nurse. So, nursing, you can get abused, while being there and taking care of patients. Also, what I want to say is everybody doesn't have the heart for nursing. If you want to get a bag, go in real estate or look up another field that you could deal with people and you can work with them in that area that will bring you joy. Because people that you interact with are not always going to be happy. Your patients are not going to be happy. Most of the time they see you is because they're sick, they're scared, they're hurting. So if you come off with that attitude of, whatever, let me hurry up and do this so I can clock out and I can collect my check, your life is going to be miserable. People are going to complain on you. They're going to report you. You're not going to be in a good, stable job because you don't even have an attitude for it. Now, what I will say, there are a lot of people in healthcare that already have messed up attitudes. It didn't happen when they started coming into nursing. They already had it. And they needed to humble themselves before even getting into the medical field, because you dealing with, like I said, different attitudes, people confused, people hurt, people scared. So when you come and you talk to an individual that's your patient and you coming off nonchalant, or you coming off as you upset at them for coming into your job to get help that you're supposed to provide, it's not for you. You might as well not even go to school. You might as well quit that job and do something else. I literally saw a nurse, a LPN, and she's been on my channel for some time. I'm not gonna mention her name because I don't agree with a lot of things that she talks about. But it's like, wow, am I tripping? Let me post this to see if y'all think the way that I'm thinking, and y'all put it in the comments. So she literally was talking about, and I'm gonna have a video of this pretty soon. I think in a couple of days. She was talking about how she interviewed at 34 weeks pregnant. When y'all have an interview, matter of fact, it's 114 people right now. When y'all have an interview, Do you get hired the next day? No. Matter of fact, when you have an interview and you're in healthcare at a hospital as a staff professional, how long does it take? I want you to put it in the comments. How long does it take for you to get hired? As in, get a job offer, go through the process, they do background checks, stuff like that. Tell me in the comments, how long does it take for you to actually start that job? Tell me. I'll tell you what I think, because I've been a traveler, I've done agency per diem, and of course I've done staff nursing. So I already know how long it takes, but I want y'all to tell me, what do you think if you're 34 weeks pregnant and you only got what is that, 6 weeks? If that baby don't come soon, how much time do you think it'll take for them to hire you? And you came out and said, I'm pregnant, my baby due next month. I need to know. I need to know. I need to know in the comments, how long do you think it takes a hospital to hire you as a nurse? Okay, let me look at these comments. You're so wonderful. Thank you. Are you wearing flip-flops or shoes? Daniel, I'm not wearing flip-flops nor shoes. I am wearing socks on my feet because I'm sitting at home, so I don't have to wear none of that. Okay. I am a medical professional. Okay, neat, unique. Let's see. Gorilla, hey from Japan. I have a brother-in-law in Japan. I need to go see him soon. Let me see. Can I get a oh? That's for you, CBJM. Also, in the field, you have administrators and nurses hiring their friends and family. So wherever there is a situation, they group up and cover. Yes, Neek, unique. You're saying it. I've noticed that way more so now in the current role that I'm in. I mean, it's a pretty good paying job, but it's cliquish. And once it's an opening, they start hiring people that they already know that's outside of this particular hospital, or they network and they bring their people together. So if something happens, yes, they do cover, which is unfortunate because everybody should be treated the same. When I was in management, I didn't cover nobody. You need to do this. If you're trying to have this time off, or if you need this day switched, you need to talk to your coworkers to see if they can switch you. I can't do that for you. Stuff like that. I do see that, which is really unfortunate, but it's something that we can't stop. We won't be able to stop because they're going to continue to do it. Okay. You can get hired next day if you're a dishwasher or do a working interview. Okay, but I'm talking, oh, well, maybe, but I'm talking about as a nurse. So let me see, 1 month. Okay. Squidward, I love that name. 2 months. Okay, nurses should intern 6 months before asking for a job. Ouch. Let me see. That message was retracted. Not sure what it was. I did my training for MA alone. It took 2 months of training. Still wasn't done. They are short-staffed due to long training after the schooling. Hi, I'm from Wisconsin. Hey, Lori. I'm guessing it takes about 3 weeks to get hired. Okay. Hello. I hope your day is wonderful as your smile. Take care. God bless. Thank you. I appreciate that. Okay, so from Michigan, big hospital is Miami and Michigan. Okay, perfect. So what I'm gonna say is, and y'all said it, between the 1 month to 2 months. So in a situation where this LPN was trying to get a job because she couldn't get anything through agency, she literally interviewed at 34 weeks. So you know when you interview, unless they're desperate and they hire you on the spot, it still takes a good 4 weeks for them to do the background check, look up your credentials. Every department has to do their part, and they're not going to do it like this. Now, maybe she's used to agency or travel where it's like this. Everything is super quick, where you can get everything done within a week. But still, before your travel assignment, not agency, but travel, before your travel assignment, it still takes time. It can take anywhere to from 2 to 4 weeks. But generally, because the hospital, their end is slower, compliance and all of that stuff, it takes about 4 weeks minimum. It could take 4 to 6 weeks for you to even start a staff position. So if you're coming into an organization and you're asking about a job and you got literally a month before you deliver, they're going to look at you like, come back to us after you deliver your baby, because you're not getting maternity leave. You usually get that after you've been working for a year with that place. Why would they have you to start and work only a week and then you deliver? It's a liability for them because they don't know your full condition. And of course, they're not going to do anything with that because, you know, they don't want to be, I don't know if you can be sued for that, but it's a liability to have somebody pregnant and they're working so close to delivering by the time they call her. I'm more than likely, if that place does call this LPN, it's gonna be when she's already delivered, and if she need the money that bad, she's probably gonna have to go back early before her full, postpartum time frame. What is an angry black female? That's something I'm not. So you clearly don't know who I am. But thanks for your comment anyway, as I'm removing it. Squidward, thanks for having my back. Okay, so that situation is just a little different for me because I guess when you're desperate for money, I've seen people go outside of nursing just to get a quick buck. And it's okay. It's okay. I've seen people go get a per diem to pick up some extra money. Say you got some bills that need to be covered, or you got a vacation you trying to, get to. And it's nothing wrong with having like a second job. It takes away your time from your family for sure. So you better make sure it's worth it. But what I will say is this LPN versus RN thing is ridiculous. Because if you're working with, say the setting is, you're at a facility or you're at a hospital and you're working with a team. You got your tech, you got your LPN, your RN. Even though the person that said, oh, I could do circles around a RN, that RN is going to delegate stuff to you. And in the hospital setting, when I worked in the ER, we had LPNs, and I'm pretty cool with a few of them. We worked as a team, but they couldn't do everything. So they needed that RN to help them. So whether you run circles around an RN, you can't do everything by yourself. In a long-term care facility or nursing home, maybe so. But some of those nursing homes require RNs because there are certain drips that LPNs can't do or shouldn't do. So, I think we should just cut all of this BS out and just realize that it's nothing wrong with being an LPN. It's nothing wrong with being an RN. Most of the time, those LPNs level up unless they don't want to go back to school. And that's okay. But some want to level up to get more money. Some want to level up because they want to become a nurse practitioner or a CRNA, or they want to get into nurse management. It happens. So, I like what's the lady? The lady that I've did a couple videos on, she was an NP, and I kind of went over her history, and she was an LPN in 08, became an RN, what was it, in 2013, and then just got her NP 2 years ago, all to throw it down the drain, okay, just for saying racial slurs. Terrible. We work hard for everything that we do, in the nursing field. And I mean, it's always going to be misconceptions out there of, oh, you think you better than everybody because you're this, or you think you better than everybody because you get paid a couple dollars more. That's not always the case. It's some LPNs that make bank. It's some of them that have per diems that just pick up. And of course, when you work per diem, you should be making more hourly wage than staff, full-time or part-time staff. That's the whole benefit of per diem, because you're not able to get any benefits, so they need to be paying you more. So this whole thing of, I'm gonna look at the comments in a second, this whole thing of somebody is better than one, it needs to stop, for real. I mean, and then even like I was mentioning, the nurse practitioner that had an MD in her title, I mean, her license got revoked in 2 days because of her racial slurs. But all of that time since '08, you've been in nursing, and you wait until 2024 to get caught up saying that crap to your patients. And they both said some choice words, but of course the patient ain't gonna get their license revoked. It's gonna be the medical profession. So you have to watch what you say. You have to watch what you do. You're at work, they're recording you. You know how many people get upset that's not even a part of that situation that'll still report you? I'm pretty sure that the person that was recording and said that she was going to put her on Google didn't even think about reporting her. It was other people that called and said, look, this is her name, this is her information. You can look up nursing licenses online. All you need to know is the name and the state. And they probably had her reported that quick and had the video footage. You never know. Everybody watches social media. It could have been somebody that was on the board of nursing in Ohio where she lives that saw it. And all of that time down the drain. Okay. Let me go up to these comments 1 second. You said I seem like a great non-ghetto black woman, wouldn't mind you as my neighbor at all. Okay. Thanks. You know what? I was taught how to speak correctly, but I mean, I grew up in the hood, but I know how to articulate certain things, and even my daughters, they know how to talk with some slang, but in my house, I raised them to be articulate. So when they have to go and talk to individuals, they know how to carry themselves, they know how to hold a conversation, and it's no big deal. Now, me growing up in the hood and me now, I mean, I just, that upgrowing in the ghetto or in the hood, it just shows me what I need to look around in my surroundings. But my professionalism is not going to change based on where I am, because people can teach themselves how to be the correct way, use the correct terminology. I mean, it's dictionaries, it's a Google, it's stuff like that. So that's what I'm going to say about that. Okay, George M. Of course, she's a nurse. Thank you. I'm interested in nursing, but I don't know where to start. Alexandria, tell me, what are you currently doing? Are you in the medical profession at all, or you're just coming from a non medical professional area? And maybe I can coach you in where you want to be to start. And actually tell me, is it an area that you prefer to work in over anything else? Med surg, ER, ICU, pediatrics, geriatrics, stuff like mental health. Let me know. Okay, Young. Hi. Let me see. Ava, I just said your name. Tell me more about flight nursing. Francis. Okay, flight nursing, I don't know a lot about because I haven't done it, but I'm sure you could use Google. Of course, you have to be a nurse, so you go through your schooling. And then what I would do is I would kind of look up what what these jobs entail, like say flight nursing, if there's something that you see on Indeed or Glassdoor or something like that. What you need to do is look at the description of what they want. Or if they have flight nurse internships, you can probably do that. But I don't know a lot about flight nursing. Nothing at all. But if it's nursing, you got to get your degree first. And I don't know if they want you to have a background of critical care or med surge. That part, I don't know. Okay. So let's see. What I will say again, if you're looking at my channel and you're not subscribed and I'm being helpful, or you've liked my content, my shorts, feel free to subscribe and put a like on this video. Okay, so another scenario that I want to discuss is the, how can I put this? So I did a video on the 30 unit, what is it, 30 unit? Hold on. I think it was called the, let me get the correct term for it. Because someone asked me, was this a good idea? And some people said no. And, okay, 30 unit option. Okay. So it's other, I guess it's other programs that was kind of like the 30 unit option, but this is in California. So I guess this is helpful, but I mean, this is not something that you do from the ground up. You have to be an LPN first. And if you want to level up from LPN to RN, you take whatever courses in this 30 unit option. It does hinder you. So I guess this is a good thing if you want to only work in your state, because you can't move, your license is not transferable. So if you want to just stay in your state and work, but I believe he said it was only home health, long-term care facilities, maybe nursing homes. I think it was like in that bundle. So, hey from Antarctica. So the thing that I would suggest is, if say you don't see yourself moving anywhere and you want to just, be in this nursing field and don't want to go back to school, but only to kind of, it gives you the opportunity to work as an RN, but it's like you're not working as an RN in a hospital setting. So, from LPN to RN in a skilled nursing facility, there's more money. Long-term care, there's more money. Home health, I'm sure, is more money. So it can be beneficial. But if you want to level up and get into nurse practitioner, any type of clinical nurse leader, clinical nurse manager, CRNA, that option is a waste of time. And the reason why I say it's a waste of time is because when you do the 30 unit option to become an RN and work in those areas, you're not able to use that to get your master's, to get into a higher level of nursing. You might as well go to school, doing a regular program, maybe what is they call a bridge program, from LPN to RN, so that when you're ready to get your master's, if you desire, then you can do it like that. So it's good for those that don't want to go back to school and do nothing else. But a lot of hospitals are requiring, if not all, bachelor's nurses. So I'm sure that this program is just like a diplomacy, maybe an associate's degree. I got my RN as an associate's degree, so it's nothing wrong with that. But I knew I needed to get my bachelor's because with the hospitals here, they want you to have your bachelor's because they want to reach a magnet status. So if you don't have your bachelor's, you can be looked over in a job setting. If they're not as desperate and they want somebody with a bachelor's because they want the majority of their nurses to have that bachelor's or that master's, then you missing out on the opportunity. So in that scenario, no, it's not a good option. But if somebody say you're LPN and you've been an LPN for 30 years and you want to level up for RN and you don't see yourself moving anywhere else or working anywhere else, you just want to level up for a little bit, make some more money and then retire, then it's perfect. If you are already working in those areas, it's perfect. Okay. Let me see. Anybody have questions while I am talking? You can feel free to put it in the comments. And let's see. Okay. So what I do want to say for RNs, there are some RNs that think they are top tier, but their attitudes are trash. Their patient care is bare minimum, and they just like what was her name? I think Neek Unique. Yeah, Neek Unique. Like how she was saying, some of them just there to get the bag. Now, I've seen this and I've observed this. I'm not saying that I necessarily would do it because I'm not in that role right now. But I've seen, I'm going to read that in just a second. But I've seen where there were nurses that maybe went to a university, so 4 years of college, got your bachelor's, worked the bedside for 1 year, like med surge, 1 year, and guess what they did? They went right into a desk job. Now, if you are in nursing and you're tired of patient care, the good thing about nursing is you can move into a different department. You can work a clinic, you can work infusion, you can work at an assurance company where you're working from home, dealing with any type of medical necessities for that insurance company. Nursing is so well rounded, you don't have to break your back working the bedside. Me, I'm over the bedside. I worked the bedside, and then I've worked in a management role, and then I've went back to different things. But it's so many things that you could do with nursing that doesn't require you having a beat up body, because bedside will beat you down. Okay, LPN, RN, CNA, it'll beat you down. The unfortunate thing about CNAs is they're kind of stuck in a certain area until you level up. So some CNAs do go back to get their LPN, or they'll say, okay, look, I'm gonna do 2 years, get my associates, and still work as a CNA while I'm getting my degree. But that's the only thing, they're kind of stuck in a certain area. But LPNs, they're LPNs that work as case managers. There's some of them that work from home from some of these facilities. There are RNs, you know. So what I will say is, if you're tired of bedside, yes, do that. But what I will recommend is, if you're trying to get something better for you, you need to have at least a good solid couple of years at the bedside and have it in a good area. Okay, so if you inspire yourself to be in leadership in a different department or something like that, it's good to have a critical care background, some type of trauma, or even med surge. But if you are, and I've said this in other videos, if you are in the running for a leadership position and they see your background is just maybe, and there's nothing wrong with oncology. I worked in it. There's some beautiful people in oncology. Say your background is just oncology, but you want to be a manager in ambulatory care. The big difference is your specialty is only on oncology. Ambulatory care is so broad, you got to make sure you can open up yourself to take care of outpatient clinics, ambulatory patients, that some may have, some oncology going in there, but you have to be so broad. So if it was between an oncology nurse or a ER or ICU nurse, they would pick the ER and ICU nurse first because they have more critical thinking. When something is going down, they're not going to run away from it, they're going to run to it because that's the way that we were trained. Okay, let me see what this says. Be weary of bridge programs too. Sometimes they give preference for courses to non-bridge program students, and it can take longer to complete your RN. Oh, really? Okay, my first name, my last name. I like that name. Okay. Totally agree. I was a CNA, LPN, RN, BSc, and now I'm a nurse practitioner. See? All right, and it was every bit as good as a nurse at LPN. So yes, it's people that go through that process, and it's nothing wrong with that. There's somebody that I think she's on YouTube, and when I met her, because we were in a natural hair group, so when I met her, I believe she was a pharmacy tech, and she was she had a small daughter. Um, I don't even think she was in elementary school. So she had a younger baby girl, and she was like, "Well, I'm gonna go to LPN so I can knock this 1 year out and then work, and then I'll go back and get my RN." So she went through that process of pharmacy tech to LPN. She got her RN. Now she's trying to get her master's as a midwife. So it's okay to go through that process. I believe that process sometimes is a little bit better because you can understand the different roles and you won't be so snooty as, oh, I'm not this, so I'm not doing that. No, it's not about that. We're a team. And everybody doesn't work as a team, which is unfortunate, but that's the way things should be. It should be a team. Now, if people get attitudes about it, it's like, okay, well, first of all, we here for the patient. So maybe it could be a perception that's off. And sometimes it just could be their personality. And I mean, it's unfortunate, but it happens. You have to deal with a lot of BS, not from patients, it's the coworkers. I should show y'all my badge reel that I have, but it says, I match energy. How we gonna act today? I wear that at work, I promise you. And it's a laughing thing, and it's not for my patients, it's for my coworkers. Because some of them need to read that badge. And, with whatever you giving off, you want me to give off the same? Now, the patients, it don't matter what they give off. I'm going to treat them sweet because they're coming in for me to help them, and then they're going to go home. So that part is not for them. And when people ask, oh, I said, oh, it's not for the patients. It's for my coworkers, and they understand. So it's what it is. Okay, what is a PHN? I don't know what PHN is. Francis, write that all the way out for me. I can't read that language because it's not English. G. Anderson, sorry. I don't have my opinion on that, kids. I think somebody asked that before. But yeah, Francis, tell me what the PHN means, and maybe I can answer what they do. Oh, public health nurse. Okay. So I believe public health nurses are more so in a clinic setting. Sometimes they'll be like at a like those doctor's appointments. Those walk-in clinics where people can just come in and they walk in and they get whatever care. Love that badge. Yes, I got it on Etsy. But from my understanding, Francis, public health nurse, sometimes they can work in the community as well. So I didn't really desire to be a public health nurse, but I did come across that information way back. But that's to my understanding. You can always Google a little bit more. Is that something that you desire to get into, Francis? And I'm trying to think who else I wrote. I had somebody to Alexandria. I don't think Alexandria wrote what area she wanted to be in nursing, or how to start. Oh, and my first name, my last name. What area? What's your specialty in nurse practitioner? I can't. This brush up is getting on my nerves. I keep seeing it and I can't tuck it in. I really can't. I'm sorry, y'all. It's probably me that's being bothered by it. Only me, not y'all. Anybody else have any comments, questions, concerns? And hopefully I can get a reply back from my first name, my last name, and also Alexandria, because I know you want to get into nursing and you're trying to see where to start. And I want to be able to help you to get through that process. Okay, surgical nursing, Francis. Okay. So OR nurses are there. What I will say is, I mean, because, and I'm not sure, Francis, if you told me what your background is, if you're already in nursing, or are you thinking about getting into nursing. But if you look up OR nurse, it's pretty much, you know, the umbrella of surgical nursing. So it's different areas: pre-op, post-op, um, post-acute care unit, PACU. There are also scrub nurses that's in there that actually work. So I'm not sure if you're talking about scrub, like in there with the providers, like handing the utensils and counting them out. That's a part of surgical nursing. There's also, and what I will say, Francis, I'm not sure if you want to go into that, but with surgical nursing, a high majority of that, these patients are on, I mean, these nurses are on call. So with some jobs, they'll have you to shadow the on call as soon as you start. And then some, they give you some type of leeway. And then, you're on call. So if you called and this is somebody that needs some type of emergency surgery, if it's your turn, then you go in regardless if you had sleep, regardless of if you partied right before, regardless of if you got your kids at home and no sitter. You're on call and you are chosen to go into your hospital. And it sometimes there's a distance that they only want you to come from, so many miles, if you're doing certain OR rotate, not rotation, but if you're an OR nurse and you're on call. I saw that, or I think IR, or what's the other one? What was it? Interventional radiology, and it was something else, because I was thinking about going into one of those. But one of the job positions said that you had to be within 10 or 15 miles from the hospital, because if they call you, they want you to get there. They don't want you driving a whole hour to get there. And, the patient is already there. So if it's an emergency surgery, they're not going to wait an hour for you to get there. So just wanted to let you know that when you think of surgical nursing, think about being on call during your time as a nurse, which sometimes it's not as bad, but I never want to be on call. I don't. I don't like the unknown. Let me know what my shift is. I mean, when I was a nurse supervisor, people would call me at any time. So, and I didn't get on call pay, but it was just, I don't like that uncertainty. Let me know I'm coming in at this time, that time. If something happens, I understand, but don't call me in outside of my hours. And people be like, oh, you getting all this bread with being on call. Okay, y'all can have it. Okay. Um, Let me go back. I finished LV in school in 20 days. How soon after do you think I should get back to my RN? Okay, so I believe in, you can kind of check with your state, because I believe in Michigan, back when I was kind of looking for a friend, you had to have so many hours worked before you can even get into like a bridge program to go and get your RN back. So you got to do your research to see if you have to have so many work hours before going for your RN. I would say maybe a year's worth if you're full time, but I'm not 100%. I'm not 100% sure. But definitely look, like if you're looking at some of these schools and they have the bridge program, look and see what their requirements are. That will help you way more than, my opinion, because it's different in each state. Okay, let's see. You look amazingly beautiful. Thank you. I appreciate that. Um, Psych. Okay. So you work in psych, but I've done it all at one point or the other. Okay. You know what? A lot of people that I know, my first name, my last name, um, I think I worked with a nurse in the ER, and he was like, I love psych. And he's a psych NP. There are actually nursing assistants that I currently work with that love psych. It's an LPN that I work with that loves psych. And, they're like, oh, I'll go back for an NP in psych. Now, working in the ER, we have that holding area for psych patients, but psych is not my cup of tea, because you always got to have your head on a swivel trying to figure out if somebody gonna do something. And then there's some settings where everybody is calm, cool, and collective. But I'm thinking about working in the ER where we're holding the psych patients before they get placement. It's not for me. But I appreciate you for doing it, because it's some people that have that heart for psych, and it's needed, because it's more things that need to be done for mental health. It needs to be more funding for mental health. It's a lot of people that need placement in different areas for mental health, and there's not enough space or room. And it needs to be more things done for sure, especially in these day and times, because more people are going through mental health issues. The pandemic made a lot of people go through a lot of mental health issues. So it definitely needs to be some more funding out there. Okay. See. So beautiful. Thank you so much. Gary, I don't know if you hungry, talking about cheeseburger. Okay. Um, Navy emergency dialysis, question mark. I was on call for that at one point, and we did go in a moment's notice. Oh, see, well, since I was a supervisor, a lot of people called off to me. So I would tell them, and I'm not trying to show my bra, that's why I'm covering it, Grant. Um, a lot of people would tell me, oh, and they will call off like the time of. So first, let's pause. When you're working and you're not called, you're not coming in and you calling off, you're going to call off the night before. So we would have morning huddles, and I would tell my staff, because I'm just a supervisor. It was a manager that just allowed it to happen. I told my staff, I said, look, y'all don't call the manager, y'all call me when you calling off. You know when you gonna call off days in advance. Or not even days in advance. You know you gonna call off the night before. Give us a heads up, so that it's people that want to pick up hours. So give us a heads up so that I can send a text alert out if anybody wants to pick up your shift that you're calling off in. Another issue was people wanted to call off because they couldn't get a day off for their doctor's appointment. And the unfortunate thing is, I started something where they can make their own schedule. Now, my type of, because I'm thinking of, when we worked at the bedside, we could make our schedule. Now, it needs to be some type of alternative day because everybody can't pick certain days or whatever. So what I did was I gave more. Why are you not upstairs? I took one second. You did not take a nap. Go back up and lay down. You didn't even try. I'm trying. You did not. Go upstairs, Puddin'. Because you cannot be here while I'm doing my live. You're going to distract me like I'm being distracted now. So go take your nap. When you get up, I'll have something for you. What? You'll see. No surprise? No surprise. You'll have something, though. Okay? Love you. You will. Because you're going to go and lay back down because you didn't take your nap. I can't turn my bed. It's okay. Sorry, she totally threw me off. But it's okay. That's my little pudding pie. I don't hear you going up the stairs. You need to be obedient, correct? Okay. Thank you. That's my little baby doll. But she needs to, usually I do these lives when she's taking a nap. And she hasn't taken a nap. I don't even cut this on if she's up because she's gonna try to be in it. So she know the routine. When I get my stuff out, oh, you doing your live? So I don't hear you going up the stairs, Pun. I don't hear your door closing. Anyway, okay, so art by Shingy. That's your shout out. Interesting. Okay, I live in California. I'll look into it. You're welcome. Let me see. Yeah, if you were really sharp, you could see it coming and you don't feel that vulnerable the same way. So, first name, last name. When I worked in the ER and, I did because I think it wasn't every week I was there, but they kind of rotate you into the psych area. Actually, since they opened up LPNs recently, since they opened up LPNs to working in the ER, they start putting LPNs there, and then the RNs will be doing more of the work that's out on the other areas of the ER. Just so that, because it's a lot of stuff that the LPNs couldn't give, but it's no infusions or anything for the psych patients that are in that holding area. So, they was just passing their Seroquels and stuff like that. They were just passing pills, making sure that they got their glucose checked, their insulin given, stuff like that. So, but when I was there, I always kind of had my back against the wall, so I was able to see certain things. And you can kind of see, like, if somebody was agitated, if they're, going back and forth, or, they just, you could kind of see it was starting to build up, and you will redirect as much as you could. I mean, the last thing you wanted to do was get security to come and, you B-52 them and you holding them down and stuff like that. But you got to do what you got to do. Okay. Mary, she's 6. Let me see. Parenting example is adorable. Thank you. Let me see. For sure, I don't mean you like skill. If you're nervous, I just mean after many years of you getting comfortable because you've seen it all. Oh, I gotcha. Yeah, I don't want to be comfortable though. I don't want to be comfortable. But yeah, they rotate people into psych and they shouldn't do that anymore. Then they should rotate them into or is specialized. Yeah. Yep. In psych could be, everybody that's in psych is not like manic. You could get patients that come into, your office or your facility, your hospital, and, they just upset and they just act a fool. And they don't necessarily have to be psych, but it can happen anywhere, to be honest. but you know 100% that when you're in psych, that it's some things that you have to look out for. And I mean, it is what it is. Let me see. I have a 6-year old too. Oh, nice. Okay, lack of skill. I meant, sorry, using voice rigging. Oh, I do that all the time when I'm texting. My first name, my last name, so I understand. Okay, do you think I could get my ex back? Is there any chance? Ricardo, I'm not a relationship coach. I don't know what you did. I don't know what your ex did. I don't know anything. But that's up to you if you can get your ex back. It's an ex for a reason. But if you think you can go and try to do that, that's on you. I don't even want to give you any advice because I don't know the situation. Okay, can other people tell me what's going on in the chat because I don't know what she's talking about? I just joined. Um, Mary? Okay, so I'll kind of sum it up for you, Mary. I think they just think she's a tarot reader or something. I'm not. I'm not Miss Cleo. Call me now. That's not me. Um, but what I was is oh, I'm sorry. Is it Mary J or Mary J? I've been saying Mary this whole time, and I see that's a J, not a Y. Um, I was just kind of talking about, like, how LPNs versus RNs, how some LPNs think that, they can say they run circles around, a new RN, which as a possibility because they're new. And I mean, I don't know if it makes them feel good that, they can say that they're doing this. I mean, it makes them look like a bully. It makes them look like they feel that they're better than anybody else because they can run circles around a new registered nurse, which is unfortunate. But I mean, people gonna feel how they want to feel in general. Now, if it was that LPN or that RN that were working together, that RN will delegate to that LPN. So whether it was circles around this LPN or not, that RN has the upper hand over the LPN. So if she needs or he needs some delegation going on, that RN can do so to that LPN. And the LPN can do so to the CNA. Or the RN can do for the CNA or LPN. Either way, because that's how it goes in healthcare. It's levels to nursing. Okay. Um, but yeah, Mary J, people are they all in my lives, they always kind of put a little extra comment, something I had nothing to do with. I had nothing to do with. I didn't say anything. Some people just decide to put anything in a comment because I don't know. And sometimes I'll dismiss it. Sometimes I'll read it, chuckle. Sometimes I'll delete it if it's just ridiculous. But yeah, so that's just a part of social media. People people just throw anything out there, whether it be the right thing to say in the scenario we're talking about or trash. Okay. Your attitude is so balanced and respectful for all of the levels of nursing. I was an excellent LPN, and I think I am a good nurse practitioner too. I respect all the levels. Yes, you know what? My first name, my last name. I actually was in MP school at the beginning of the pandemic, and I got to the part where I was doing clinical rotations. I was trying to get my clinical instructor, not my preceptors. I was trying to get my preceptors, and I just didn't feel it didn't feel right in my spirit at that time. I was like, no, but I mean, if I would have pushed through and kept going, I would have been an MP2. But I just didn't. I didn't feel like I should keep going on. I definitely next year I'm probably gonna go back. Not probably, for sure I'm gonna go back for my master's. And I have a few things that I'm thinking of, and even my daughter, because my two oldest daughters, I just moved them to college this week. So my middle child is one where she talked about being either a neonatal nurse practitioner because she loved little babies. Um, And she was just saying, well, Mom, what do you want to do? Do you want to go for education because you like to share and teach to be helpful? Do you want to go as any type of management? Like, I've been in management already. So, I mean, if I wanted to be like a nurse manager or even go up into the executive portions, of course, I would need to go back for, you know, a nurse leader. And then also, well, she was like, well, what about an NP? Like, you could still go back for that. And I'm like, well, it's different areas. And back when I was thinking of it, I was traveling. I had stopped. Was I traveling? I was starting to travel. I went into travel nursing. So what I was thinking of was the NP area was oversaturated, and I don't know how I'm gonna get a job as a nurse practitioner. Am I wasting my money because graduate school is not cheap? Now, the place that I work now, they'll pay for my master's. So it's like, okay, it's a little bit of stress that's taken off of my shoulders. And I was talking to my daughter. She said, well, as an MP, could you be in leadership? I say, yeah. I mean, it's a master's. And the place that I'm at, yes, you can. Um, you could do education if you want, but pretty much you just need a master's in nursing, and you can be an educator for a lecture, to my understanding. Correct me if I'm wrong in the comments. And then leadership. Again, it's a master's in nursing. Actually, my ER manager that I had when I was a brand new nurse, she was an MP. So she was like, well, you need to just go for your MP because you can do all of those with that. I'm not 100% sure that that's the case. If you could do all of that with your MP, of course, I know in a couple of years they want for MPs to get their doctorate, and that's okay. I mean, that's more courses to do, but I know that me as a nurse, I don't want to just work as a nurse with my bachelor's. I want to level up more to the next level because I see myself doing higher degree things, if that makes sense. Okay. Let's go back. So let me see. Let me see. I meant to text that to my. It's okay here. Um, Hello from India. Hello. Let me see. Let me see. I can delete that, Mary, if you was trying to send that to your sister, so people won't be in your business. Okay. I totally see you being excellent at that, but you do have a choice, the right time and the right place. Thank you. Okay, is it the same now? Is the MP market oversaturated? Okay, Jamie. So what I will say is and I didn't say this when I was talking, but what I will say is, and hopefully y'all are subscribed to the channel before I even say anything else, and y'all have liked the video, because I've been talking for about an hour, and hopefully the people that's interacting and that's watching and have seen me already, and y'all haven't subscribed, thank you for subscribing in advance. It's just a quick little thing, and then like it. Okay, so what I will say, Jamie, is the hospital that I'm currently at, they hire a lot of nurse practitioners. A lot of nurse practitioners. So where I was previously, I didn't see a lot of jobs in that hospital. I mean, you probably could network with, because I worked in transplant for kidneys, and I probably could network and talk to the medical director of the nephrology team, because I did, and she was like, "Oh, you get your MP, I'll definitely hire you as a nurse practitioner." I could have done that. I didn't stay there. I actually started traveling, but while I was thinking of, getting for NP, I'm like, wow, I'm listening to everybody else. First of all, a friend of mine, I call her my nurse sister. Her sister-in-law is an NP, and what she had to do during the pandemic was work as an RN, because it was nothing. She got laid off from her job, and it was nothing that was there for her. There's also a content creator that was an NP, and she got laid off of her job. And it was just like, I'm looking at around that time where being an RN was more sustainable. It was more having job security, because a lot of businesses shut down based on different things and they couldn't hold afloat. So I look at it now after it's been 3, 4 years. Well, I'll say 3 and some change years of, being in the field and seeing that it depends on your hospital who hire the nurse practitioners. This one in particular, and I'm not going to say where I work, because no, I do have some coworkers that have noticed my channel and have said something. So I'm not really going to say where I work at, but I see multiple nurse practitioner jobs. I'm saying, because I look on the website just to, sometimes if I see something that a friend of mine or an old coworker of mine want to get into at my hospital, I may email them a link so that they can apply, because most of the jobs are only there for like 5 days, so you got to be on top of it. But what I will say is, if I do decide to go back for NP, I definitely will have a job. And the place that I work at currently, I mean, they start you off with 6 figures with benefits. So it's no problem. I've heard stories of people where they started as an NP, maybe at a doctor's office, helping one of the doctors to help um, see his patients or her patients. And, they were only offered like 80, 90,000 and no benefits, which is unfortunate because you're used to having benefits. But if you're working at a private practice, this is something that the doctor is going to factor in if they want to give you all of this as a brand new MP. Now, what I will say is, after a year has passed, most, if not all, MPs get a rate increase with benefits if they stay at that place. But that was just my mindset back then. I didn't think that I was gonna be able to get a job, and I'm spending all this money on my on my master's in graduate school, and I'm gonna be in a lot of debt. So it's not saturated in certain areas, but definitely do your research, because I mean, if you're in a compact state, I'm in first name, last name, correct me if I'm wrong. Um, correct me if I'm wrong. Is it the same for NPs, where if you're in a compact state, you can pay for a compact license endorsement, or is that just for RNs or LPNs? Let me know in the comments, because I don't want to say that and it's not the case. Okay. Let's see. Let me go up to these comments I'm missing. My friend that works at my job, she and her husband into LPN, but we never talk about LPN or nothing like this. But thank you for helping me. No problem. Okay. You will make an excellent educator, though. I mean, that's what you're doing here. Exactly. My first name, my last name. That's exactly what I'm doing here. It is. What I do know is, when I was doing my research back when, like, the educators were not paying a good amount. Like where I'm currently at, I'm getting paid more than some educators. So I don't want to go to school for something and I get a job offer and I'm getting a huge pay cut, unless I'm doing I'm full-time lecturer, and then I'm doing some per diem stuff, which when you level up, and this is just me, when you level up your degree, you level up your income, and I only want one job. I don't want to work multiple jobs just to get a certain amount of money. I want it all in one job. Now, YouTube is something that I'm always going to have, and that gives me an income as well. But for nursing, I think when you have multiple jobs, it takes away from your family. Like the little girl that you heard in the background, that's my 6 year old. It will be different if I was an empty nester. My two oldest are in college now. They start on Monday, but I have a little one. So I don't want to take away that time from her and my husband because I want to, like I said, have one job where it pays me more than what I'm currently making. And I see that in the hospital that I'm at because they start their NPs off 6 figures. The nurse educators, I believe, are a little bit under, but I believe they're close to the 6 figure range, like maybe 95, 96,000 a year, like that. Which that portion they're paying more than what you would see a regular university to pay. So if you're an educator in a hospital, sometimes the hospitals pay more, but it all depends on where you work. Um, you are young enough where you can do a whole bunch of different things. Well, thank you. You know what? I am on the younger side. I still got some time to do some things, but I don't want to be all over the place. So I'm a researcher, so I'm trying to figure out what I want to do. If I'm going to go back to school next year, I need to figure out what I'm going to do and stick to it and complete it. And not really listen to what other people are saying about this and about that, because I believe that all three of the areas are pretty decent. You know, being an educator, I do want to teach the upcoming nurses the real, because in school you're taught in a perfect world. They don't tell you like the what to look out for. You just go to work and you see it. I do want to share that with people. Um, of course, with whatever school curriculum they have you to do this, but I will put little sidebars in there like, hey, I'm just gonna let y'all know, nursing is not all, roses and sunshine and beautiful days and birds chirping in the morning. It's not. It's hard at times, but nobody says that in school. I'll be the person that say it. And I mean, I say it on my channel too, but I know I'm not reaching all nursing students. I'm talking to people that already been through, the chaos of the beginning portion of nursing where you become adaptable and you're like, okay, I know what to do now. So, okay. My daughter loved being a doctor. Like her whole room is Doc McStuffins. My middle daughter loved Doc McStuffins, by the way. Um, she wants to be adopted when she grew up. She loves kids, loves baby, pick up babies all the time. Aw, that's so sweet. Okay. My first name, my last name. Oh my God, I did travel nursing too. Went on my first NP travel assignment in Washington 2 weeks before COVID arrived there. Oh. So tell me, my first name, my last name, how was it being a travel NP? Was it, I'm sure it was chaotic because you're traveling. So, I mean, going into travel, that means they needed your help. They had little to no staff. Um, or maybe they had a good amount of staff, but staff just kept calling in, because I've seen those situations in 2 of my assignments where where's the staff at, or staff will quit. So I mean, you lose 5, 6 people within a certain time frame. You need more staff and you need them quick. But tell me, how was it as a travel NP? Goodness, this bra strap is gonna get on my nerves, y'all. Okay. How old were you? Because my friend's husband is in his least his 40s and he's an LPN. Not to be like mention how your age is, but like how old can you be? How old can you be to be an LPN? Uh, you could be whatever age you want to be. I mean, 40 is still good in a nursing profession. I mean, I've met LPNs, RNs that were like early 20s. And I went to school with a couple of young ladies that were 50 or 51 or in their 50s or close to 50 in nursing school. So, I mean, nursing doesn't have an age. As long as your body is able to get up and move around and function. I mean, because when you get out of school, they're going to want you to work the bedside. There's no way getting around that unless you know somebody and you work in home health or something like that. But your foundation should be at the bedside. So if you can work 12-hour shifts, 3 12s, or if you want to pick up overtime as time goes, you can. But you definitely need to make sure that your body is capable of working a 12-hour shift. If you got that, age don't matter. Now, if you can't do it, they won't hire you and you wasted a lot of your time and money on school. Okay. Um, Abel, what's up? I said it for you. Okay, right. Now, the NP market is getting saturated in certain areas, especially Psych, because I'm sure that's probably Psych, right? My first name, my last name is probably Psych. Okay, because people think it pays a bunch more. You're going to hate it, and the pay differential is much less due to market saturation. Well, you know what? What I will say is when I was looking at different roles for nurse practitioner years back, they do say the Psych NP makes the most money. And a lot of people are getting into Psych NP for more money. Of course, now, like if you look, it'll say aesthetic NP where you're doing the injections and stuff like that. Um, but years back, it used to be the Psych NP that made the most money. So people was like, oh, I could do that. I could be a Psych NP. So now that the Psych NP area is oversaturated, you ain't getting those big funds because I'm sure people didn't really want to be Psych NPs like that, or they didn't know that Psych NPs made a certain amount of coin, and now they're trying to get the bag. Okay. Discussion algorithm. Hi, are you? Yes, I am happily married. Let me see. Can you put on what? Can you put something on? No, no. I don't even know what that is supposed to be. Anyway, what time does this end? Because I have to go to work at 3:34 and it's already 2. Oh no, you know what? If you subscribe to the channel, I'm gonna leave this up. So when I get done, you know, because usually my lives I just let them go. I communicate with, the people that's on the channel, whether they're subscribers or not. So if you can't stay the whole time, it's okay. But usually my lives is over an hour, which is already over an hour. So I tend to stop usually when my daughter wakes up, which she didn't even take her nap, but I think she's back in her room. But I want to make sure that I'm interacting with everybody. And if you have a comment or question that you have for me before you go, I'll answer it and just come back to the live at a later time. Okay. MPs do fairly often go back to BSN work for the hours because the pay is very close when you're experienced and for the freedom to switch specialties. Okay. Let me see. My daughter has a YouTube channel, but how do you get money from actual, not from YouTube? Because she is about to be 13 next year. She is having her YouTube channel since she was 6 for 12 years. Okay. So with YouTube, because this is my second YouTube channel. My first YouTube channel was monetized. I've had it for a couple of years, and then the day before New Year's Eve, somebody wanted me to do a brand deal. It was fake. It was malware. They hacked into my computer because I used a different computer, and I couldn't do it on my Mac, but somebody hacked in and they took over my channel, and I told my subscribers to report it, and they actually canceled my whole channel. So I had to start off from scratch. So with this channel, it actually grew way quicker than my other one. My other channel was like 24,000 subscribers, and it took me 2 years for this. I started this channel on December the 31st of 2023, and it hasn't even been a year old, and I've surpassed it. So what I'll tell you is, when you're trying to get money from it, I don't know if she has a kids channel because of her age, but you got to go into the analytics to see if she has enough subscribers, if she has enough watch hours, and if once she has those within a 1 year time span, if she has that, then they'll allow her to be monetized and go from there. Okay. Let's see. My first name, my last name. The compact only matters in that you do not have to also get a separate RN license in the state the way that you would if you're a non-compact state before you go ahead and do the application for NP. So I'm aware of the compact license because I'm in Michigan, so we're not a compact state, but like I have a license in Ohio. So if I lived in Ohio, I know that I can just pay for the endorsement and I can work in other compact states. But my question was, for NPs, is it the same thing for your NP license? Like, I know RNs, what we could do, but for an NP license, can you get an endorsement for compact as well if you're in a compact state and you can go and travel with that, if that makes sense? Okay. Let me go down. Yes, I would love to be an educator too, part time, but no way I could afford to live on. It's about 60 or 80% of what you make elsewhere. So I would love to be an educator too, part time. No way I could afford to live on that. So you see how like the educator role is less than, but it's like you're training up the new nurses. Okay, they always say it's a nurse shortage. You're training up the new nurses, and you're not even getting what you can get as an art. Like, I'm getting paid more as a bachelor nurse than something that I would love to go back to school and do. And you live under your means, but if you go back to school and you get all the student loan debt, and then you're getting a job paying less than what you're accustomed to, you're already living under your means, but you really got to live under your means with a lower amount. You know what I'm saying? Chloe, you taking a HESI exam September the 3rd. I'm so nervous. I pray that you pass that I pray that you pass that HESI exam on the first try with no problems. Make sure that the night before you get some good sleep, total peace. Eat some breakfast in the morning if you eat breakfast, and just totally, like, when you driving to go take that, have some calm music, have some lavender scent on that's calming. Okay, get that that area to be nice and calm, cool, collective, so that when you get there, you focus on your test and you knock it out. Keep me posted, Chloe, on what happens. Okay. No, you don't get that time back, and you are absolutely right. If I had that choice, I would wait. Okay, how old were you when you started doing your research? Because I am in my 40s, and I started doing my research when I was 16 for jobs, and a new friend and her husband since they were 16. We've almost been. So, Mary, you talking about research. Usually when I research something, I research it for a couple of years, and then if it's for me, I'll do it. I won't take a long amount of time for it, because the way that I am, when I want to know some information, I just get right to it. I get right to it. If it's somebody I need to call, if it's a school I need to speak with, if it's people that I know that are in that area, or if I'm following someone's channel that's in that area, I'll send them a message. I think the best research comes from the people that are actually in that field. But if you can't find anyone, it's okay to use Google. It is okay. I mean, look, YouTube is Google. It's okay to go to YouTube and look up whatever area you're trying to get into, and reach out to those content creators to see if they will give you some information from their end. Most of the time, if you're on YouTube, you want to talk to the audience. That's why you're here. You want to talk to people. You want to be of assistance to get them in the right area if you have that knowledge to do so. Okay. Um, I'm almost all NP jobs are salary, even though they won't tell you the pay overtime. They fire you if you use it. Oh. So your channel becoming a website where you can do coaching and support and maybe even offer third-party exam prep classes for nursing. Huh. You just gave me an idea. It's like being a travel RN. You get the toughest assignments and you try to get more out of you than they get out of their own staff. The money is good, but not as good as they say. Well, yeah, with travel, yeah, they want you to do all of the hard, heavy lifting. I mean, they want to keep their staff, but it is what it is. You know, with travel, you get paid to do the not necessarily the worst jobs, but think about you going into somewhere where you doing the worst thing. I just didn't know what was the difference for NP, because if you're a provider, you just kind of like briefly kind of go over the patient's chart to assess them and see what they need and go from there. To me, I think NP travel would be harder, but I don't know if it's. Have you ever worked as a travel RN? Because I don't know. I don't know if a travel NP will be harder or if the RN travel jobs are harder. I just know from the RN's perspective. Some of the assignments were not as bad, especially when you work at one facility where you doing everything and then you travel to another facility that pays almost twice as much and you have people to help you. It's just they were a low paid hospital and a lot of their staff was quitting. So they needed more people from the travel agencies to help them because we get in there so quick with minimal orientation. Okay, so let's see what else. One of their nurses refused to come to work because she thought she'd get COVID. So I and another traveler provider had to split her patients. Wow. So she refused to come to work because of COVID. So she's not work. She don't have a job then. Like you can't refuse to come to work. Like what is she trying to do? Telehealth? You she wasn't gonna work then. She might as well resign from her job if she wasn't gonna come to work. You got to see your patients. Unless it was set up for y'all to do telehealth, then no, that's terrible. I don't even know. Let me know if she even was still there as a nurse practitioner if she refused to come to work. I mean, it's scary. Maybe she had some type of um, autoimmune disease or something like that, where or maybe she had some type of what do you call it? Maybe on immunosuppressants where she didn't want to get into that, because a lot of people got work from home jobs when the pandemic happened. They behinds work from home and they did not want to come back. So maybe that was the case. Okay. Let's see. Hello, man from India. Hey, crazy girl. Um, but I love travel and I wanted to see the Pacific. I got stuck there for a year because of COVID, so it was good. I like to travel. Okay. Timothy, what's is NP, nurse practitioner? I'm just talking to one of the NPs that's in the comments because I just had questions about that. But yes, NP, nurse practitioner. I used to be, we made about 10% more. But the market is so saturated for the psych MPs that the differential is disappearing and the jobs are getting much harder to find. Okay. The psych certification only became available in 2015. And before then, former psych RNs uh, who were FMPs did psych, and that's why more money back then. Gotcha. Okay. Um, no, I don't want to do a video chat, Patrick. Nathaniel, okay. Keep working on Robert. I keep working on my path towards NP. I'm a previous nurse, core dropped out, and next year I'll be back in my nursing program. Just wanted to say thanks for giving us our future endeavors. No problem, Robert. Do you know what area do you want to work as an NP? Do you want to go for nursing work a little? Well, I would recommend going to do nursing, work for some time, and then go for NP so you can have your nurse judgment. I did see it was somewhere where it was somebody that just went straight to school and worked as an NP and, all the way to NP and didn't have any time in between where they worked as a nurse. I don't recommend that because the good thing about being an NP is when you work as a nurse, a RN, LPN, go to RN, when you work as a nurse, you are able to get proper bedside manner. You kind of see what the what the doctors, goodness, you kind of see what the doctors do, and nurses are more so, we get more detail on the patient. The doctors are in there that long. What I do say is when you have a nurse practitioner, the nurse practitioners are used to that bedside manner and maybe will stick with the patient a little bit longer to see what else is going on instead of, oh, I'll get the information from the nurse. You were the nurse, so you want to get that detail. You want to make sure that everything that you're getting is correct, so on and so forth. Okay. I appreciate this channel. I'm also looking in a direction to start. Uh-oh. I was trying to read that, Robert. It got retracted. I don't know. I don't know if you retracted it, but I was trying to read that, Robert. So if you want to put that back, feel free to. No. You about to get Nathan. Yeah, you're about to be put on a timeout because no, we're not doing that. Y'all doing too much. You doing too much. Okay. There's no compact for nurse practitioners. Okay, that's what I was wondering if they had that going on. Only for RN part is covered by the compact, and you have to apply and meet criteria for the NP in each state. Oh, I wonder what the criteria is. I'm sure it's different in each state, but is it? Give us like a little, or give me a little brief synopsis of what's the criteria. Say you're going to the state next to you, or say when you went to Washington, what was the criteria that you needed to get a license with Washington? Was it like so many work hours, so many years as an NP? Was it? Tell me like briefly what it was. You said yes, I have massive student loans. I'm sure you do, because graduate school is not cheap, not cheap at all. I mean, and you don't really get financial aid other than loans unless you find like some good grants that's out there. So when your job is offering to pay for your masters, I'm like, yeah, I'm about to do that. And then I mean, of course, they want you to stick with them for so many years. And if you're gonna pay for my masters, okay, y'all paying a little bit more than the regular, places anyway. So I'm fine with that. Yes, not quite. You didn't even take a nap, did you? You didn't. So stay for a little bit, okay? You can play with your toys. Yep, I'll let you know. Okay. All right. So The little one didn't take a nap, but she's like, okay, I'll play in my room. Okay, I don't know if y'all heard her or not, but she all the way upstairs. But she probably at the top of the stairs saying something to me. Okay, let me go back to no, she got to take a medical leave because at that time COVID was fatal. We didn't know what caused it and there was no vaccine. Okay, I understand. My first name, my last name. So what's good that she was able to take a medical leave. I'm sure they probably was just trying to hold on to their staff. And I mean, it was scary. Like, my primary care literally retired early. She was like, nope, I'm not dealing with none of that. They shut down the clinic, and next thing I know, after so many months, I got an email that she retired, and oh, she was perfect. She was perfect. She was thorough with you. She dictated right in front of you everything that she put in your note, and she even said a prayer over you before you left. You ain't gonna find that. You not. Man, you not. Okay. Um. Hello, everybody that's saying hello, hello. The other travelers was an MD, but a person who refused was a physician's assistant in psych acute care. Oh, okay. So it was a travel. It was a travel doc, and the person that refused was a physician's assistant. You know what? Some people are upset that you can work as a physician's assistant after 2 years from the street, as this is what I've heard. But in order to be a nurse practitioner, you have to go through nursing school, get your bachelor's, then your master's. So in a perfect world, you went to school for about 6 years just to get your NP, and the physician's assistant or a PA only went to school for 2 years, and they getting pretty much the same amount you are. A lot of PAs that I've come across, they're going to medical school, but they wanted to get something first. So that'll always be like I wonder why in my mind, because 2 years and boom, you a physician assistant, working alongside and delegating orders to, nurses, techs, working under a doctor, just like an NP, but less time. I don't know. I think that people may cherish a nurse practitioner more because you work the bedside, you have nurse judgment, you took all of this time to go to school to get your NP. So much respect to NPs, 100%, 100%. Okay. What is all of this in a sneezy? Happy birthday! I just said happy birthday to you. I don't know what this is in the comments, but it's about to get muted. Anybody else have anything to add on to? Have any questions? Um, or comments that make sense towards what we're talking about, because people are just kind of like writing anything in the comments, and now I'm gonna put them on timeout. Don't I sound like a mom? You're gonna go on timeout. I didn't know that you could time out anybody until a couple of months ago. I don't know if this was something that they added to live streams, but yeah, definitely put them two on timeout because they was just commenting and it had nothing to do with anything we're talking about. So if you still here, you said best advice you got. Best advice for what, Tanisha? Let me know what you need advice about. Anything. Oh, but it's a lot of things that you could give advice about. Are you talking about in healthcare, as a nurse, in life, as a mom, as a content creator? Give me specifics. Okay, about life. Life is short, and what I will tell you is there are a lot of people on this earth that will do things to be intimidating, to be mean, to be hateful, and never let them break your light. Never let them stop your shine. People can be miserable. People can do things to you, even on social media, because they're hiding behind a computer. They're hiding behind a phone where they know they probably won't even see you. Never let that affect you. Never let it tear you down. You are important, whether you're important to your parents, your children, yourself. Never doubt yourself. Always achieve for greatness because you only have one life to live. Hopefully, that was something for you. Anybody else have any comments, questions, concerns? And hopefully, y'all already subscribed to the channel and you gave this video a like. Appreciate y'all. But I do want to talk more if y'all want to talk. Maybe for a few more minutes. Because I got time. Anybody currently, hello, is it STEM? You see, thank you so much, ma'am. Needed that. No problem, Tanisha. I mean, everybody needs some inspirational things, but we also need to hear the truth about, it's bullying out here. And maybe the young me, it would bother me. I mean, like young, like teenager young. But me now, it doesn't bother me at all. Even when I get comments um, on my comments in my shorts, because if you see that I heart a comment or I respond to it, I'm acknowledging it. It doesn't necessarily mean that I agree with you, but I'm acknowledging your comment. I see all type of stuff in my comments online, and it's some stuff that's just like, okay, this is harassment, this is gonna get reported. Some stuff people just want to be heard. So, I'll do the or the emoji, or some things just people just want to say to get stuff off their chest. It has nothing to do with you. And it don't bother me because when it's on the internet, and if it's on a platform, whether it's YouTube, Instagram, TikTok, Facebook, X, which is the old Twitter, you can always remove it, block it, delete it, and just brush it off your shoulders, because remember the importance that's within you. Nobody will know that. Only you will. Okay. Aw, I appreciate that, Tanisha. Okay, let me see. I'm still 19. See, I have a daughter that's 19, and I try to spill stuff into her that's uplifting, whether she want to hear it or not, because it's mom, I try my best to put little nuggets in there to show how wonderful and beautiful and thoughtful she is. But I know at that time you're kind of like, I don't know what to do. I'm trying to figure out what I want to be in life. The world is different now, But thanks for saying that. Okay. There are subsidized student loans for grad school, but not grants. When you subtract the cost of loan payback compare that to RN pay. Not I didn't mean to say grants, my first name, my last name. It is no grants, because remember, I was in NP school for about how many semesters? Maybe I've done about maybe 5 or 6 classes. So I was there. It is no grants whatsoever. I meant to say scholarships. Scholarships. Like if you can find a scholarship for that, perfect. Because graduate school is where the debt tackles onto you 100%. And I know you know. Okay. Thanks for the advice. I definitely plan on working as a nurse for a year and a half before starting NP school. I plan on staying in the hospital and working with a team. Not sure of the if the specialty, maybe of the specialty. So what I will say, Robert, is that is good because even when you're working as a nurse for a year and a half, NP school is going to take a minimal 2 years. So now you're going to be working as a nurse for 3.5 years when you go into NP, minimal. So you want to still have that judgment, that nurse judgment, because a year and a half is good, but 3.5 is better. Okay. Others, it might, maybe this was something previous. Okay. Oh, I just missed something. Hold on. One typical difference in NP criteria state to state is how many hours of supervised prescribing you need to have before you prescribe independently or do controlled substances. Oh, okay. Others might be how many hours you have in grade level pharmacology and how many hours of clinical practicum. Some states want you to have a certain number of hours of supervised practice. Gotcha. Okay. Um, Robert, do you have any scholarship advice or avenues to pay for school? Thank you so much. So, Robert, I don't have a lot of scholarship advice other than the school that you're at. Sometimes, well, if you're going for registered nurse, check the school. The school will provide grants. They will provide scholarships. You can always Google scholarships for nursing because there are going to be way more scholarships for undergrad nursing than you'll see at a graduate level. At a graduate level, I mean, you probably would do probably like how I am. Let your job pay for it. Now, if your job already paid for your undergrad, then more than likely they probably not gonna pay for your graduate. I mean your master's. So Google undergrad nursing scholarships, and most of them they want you to either write an essay or stuff like that. The ones that really pay, you gonna have to write essays for them, and it's okay. Um, it's worth it so that you don't have to pay all the student loan debt. All right. Do you think your can you what is up with this? I don't even get what that means, so I'm just gonna delete that because it don't make no sense. And not trying to be mean, but it don't. So, okay. Oops. Comment disappeared. Uh, Main difference from NP criteria is core classes, clinical hours, and how much supervised practice you need before having the privilege that state allows. I live in a very restrictive state. I refuse to work here. I work by remote independent practice states. Oh, okay. So are you are a remote NP for Psych? My first name, my last name. Let me know in the comments. You schooling me on some stuff. I just want to know because I follow there's an MP that is a telehealth MP that telehealth is remote. So let me know if that's what you do too. Okay. And I'm currently an MA. Do you think it's worth it to become an RN? I will prefer MP. Nurses get so much crap. So, STEM, you said you were MA and you are, well, it depends. If you want to be a medical assistant for your, duration of your healthcare career, more to it. If you want, that's all for you. That's up to you. But if you want to be an RN, um, I would definitely tell you to go into, being an RN. I know with MAs, you do injections, um, you know, you do vitals and things of that sort, medication reconciliation. You do some nursing things. Um, But if you want to expand more, it's definitely worth being an RN. Yes. If you want to get out of a doctor's office, yes. If you, because I mean, you could work at a hospital as a medical assistant, but if you want to do more and extend your knowledge in nursing, absolutely. Let me see. You would prefer NP. So if you want to go MA to NP, you must go to nursing school. Like I was telling Robert, get your nurse judgment, work the bedside. You go back to NP school, right? But make sure that you work as a nurse first. While you're at NP school, it may take, anywhere between 2 to 3 years, depending on where you are, or if you're doing it part time or full time. And while you're doing that, you're still working as a nurse. So you're getting more of that bedside nursing, nurse judgment, things of that sort. So I don't recommend you going straight into NP without working as an RN, because you're wasting your time, because employers are going to want to know where you worked. So say you're a MA, you find a program that have you to work from where you are now straight to NP. Of course, you have clinicals, but people are going to want to see on your resume, what have you done as a nurse before being a nurse practitioner, if that makes sense. Because when I was in management, when I looked at resumes, I did look to see what did they do beforehand. How do you handle stress for stressful patients? You're going to deal with that as a nurse. You're going to deal with that as an NP. And my first name, my last name can tell you, because she's an NP or he's an NP. I'm not sure if it's she or he, but they're an NP, and you still deal with trash. You just get paid a little bit more money. Um, so I do recommend definitely getting um, your RN to work first. Like I told Robert, then go up to NP. Whichever field you decide to go for NP, that's up to you. But you can use that time where you're working as an RN to see what specialties you want to be in for that nurse practitioner. Okay. Reading teacher says all. Okay. Um, 2 to 4,000 hours of supervised practice is required in some states before you can prescribe independently. In some, you do need to graduate and pass boards. Okay. So many people join a program and go from zero to NP. That's becoming more available, but they make crummy NP sometimes. 2 years of RN is usually required. My first name, my last name. I didn't even see that, but that's what I've been saying, right? I've been saying, get your RN, work the bedside. Robert said he wanted to work a year and a half, then go to NP school. But while he's in NP school, it takes an extra, 2 years or 2.5, depending on the school, or 3, depending on the school. That whole time, you have nurse practice, nurse judgment, nurse experience. So when you get to be an NP, you're better off. But that straight to NP, I don't think is good at all, because now you're going to be questioning, like, okay, where'd you go to school? Where did you work as a nurse? Oh, you didn't work as a nurse. I don't want you taking care of me because you just book smart. You pass boards. That nobody wants. But everybody is not going to want to ask certain things. And then if you're a seasoned nurse and you have a nurse practitioner that's your provider, and they seem like they don't know simple things that you would get as a nurse, that's a red flag to me. Like, I don't want you, I don't know. I don't want no interaction with that, because you're over my care. So then it becomes anybody can get an NP, which it shouldn't be. You need to have some requirements for that. And some schools just want you to go from zero to NP, and they just take all your money, which is not good. And then you also have to think about what hospitals will allow you to work as an NP with no nursing background at all. None. That's something to question too. Okay. Let's see. Let's see. Let me go back to the comments. I don't want to miss any. STEM, thank you. You're welcome. You are, you know your stuff. I'm trying. Like I said, I do a lot of research. So, um, because I do want to venture off into something else. I mean, I just had my bachelor's. I want to level up, but I want to make sure that I'm leveling up in the right area. And I think I will be good as an educator. I would be good as a nurse leader, and I would be good as an NP. I was just scared for the NP area back then because a lot of NPs were getting laid off. So I'm like, why am I going for my master's if I'm not going to have a job and I'm going to be working as an RN still? So, I mean, I have to clear my mind of that because, like I said, where I am now, it's multiple NP jobs, and I don't see them going away because if they open up different areas, they need different people to come in. So, all right. Yes, remote NP for Psych. That requires a few years experience, but it will allow you freedom to travel, work, and work sometimes from home. That's pretty cool. Now, I'm sorry, I'm just trying to hold that belch in. Gotta be a lady. There are some telehealth roles that I have seen, like their home health telehealth roles that I've seen. Not saying that I want to get into that. I definitely, if I was to go back for NP, I would definitely want to work and talk to, my patients. It don't necessarily have to be on the screen. I need to actually get to know you, and then if we have a video visit, perfect. But video visits, telehealth, all remote, that's all becoming more obtainable now because of the pandemic, and a lot of people don't.
I need to get my journal book.
Okay. This child moseyed back down. You can hear her beads. You want to say hello?
Yes.
So look here. No. Look here. Look here.
Hello.
Look, you got to come over so they can see you.
Hi.
Here.
Hi.
Look up.
Hi.
Okay. Bye-bye.
I want my necklace candy after the video.
Okay.
Please.
Okay. Let me finish. Not there. No, because your beads going to be clinging around. Were you trying to go back to your room, or you want to go in the kitchen?
In the kitchen.
You want to get a snack?
Yes, my necklace.
No, that's candy. Do you want to get a snack? You want to get some fruit, applesauce?
Yes.
Okay, get one of those.
I want to get peach.
Oh, that means I have to open it up and pour out the juice. Get the applesauce.
No, I don't have to pour out the juice. I want the juice.
Oh, Jesus. Okay, what you need to do is go get your utensil.
What is an utensil?
Utensil?
Mm-hmm.
Fork, spoon.
Fork, spoon.
That's a utensil. Get one of those. And I'm trying not to spill it. Look what she got me doing. Hold on. Because I don't want to spill this. You want to drink the juice?
Yes.
Nasty. You don't need both. What you gonna eat with? The spoon or the fork? Ah! See, I just splashed it on me.
Can I see?
It's just on my arm. It's okay. Let me get back to my video. Here.
I'm using a fork.
Come on, child, so I can finish.
Okay, y'all.
Okay, go sit in the kitchen, please.
You can
Drink some of that so you don't spill it. I never drink the juice. I don't know about y'all, but this girl love drinking the juice off of fruit. That's why I get light stir up or no sugar added or something, because she'll be bouncing off the walls. Excuse me. Kitchen.
Bless you.
Thank you. get my voice together. Okay. You didn't consider that. What? Hold on 1 second, y'all. The nursing, you said we look alike. Oh Lord, you didn't screenshot my you didn't screenshot my name. And I mean you didn't screenshot my live and put it on your channel. Please take that off. Thank you so much. Okay. Anyway, so the nursing judgment instinct and time spent is what makes NPs as good as MDs. Yes.
Can I go to sleep early?
We'll talk about that later. Just eat your fruit.
Okay.
Okay. When we do the same job without that background, we're often as bad as MDs. It makes us out to be. I feel like it's interesting, but I feel like that's interesting, but because you go straight to PA school. So, STEM. I don't remember. Let me see. Did you say were you the person that were taking the, let me see. I don't remember if you were telling me that you were taking, uh-oh. Where's my little, you think PA school is something that you want to get into, STEM, instead of nursing? Okay. My first name, my last name. Yes, and now that schools are not necessarily required 2-year RN work for entry, there are 2-year residencies on the back end of new grads with no RN experience, and you don't earn full NP money. I'm sure you don't, because I mean, even at my job that I'm currently at, they have NP um they have NP positions, and it tell you the range of how much. So I'm sure, but to be honest, they're so strict on where you go to school at if it's not accredited, or if it's just something that just opened up and you get your RN, BSN, not BSN, but if you get your RN through this new school, or your LPN through this new school, they're not hiring you. It's literally a school that just started up. No shade against it. I think it's called, no, I'm not even gonna say the name. When you see a new school that pops up, it takes time to get accreditation. So do your research before going to these schools that's gonna give you an LPN or your RN within a matter of months, like 18 months for RN, and 10 months for LPN. Do your research, because some of these hospitals are cracking down since, remember when that whole, see, it's not on this channel, it was on my old channel, when those Florida nurses were paying to get their degrees, and they were given NCLEX answers, and they were going for testing and stuff like that, and they were passing. A lot of places have cracked down, and they want to see your your um your transcripts. They want to know what school you at. They're gonna put it in the system to see if it's accredited, and they're not having that no more. Because if you go to a school and you don't have if you go to a school and everything is not lined up, then the people that hired those Florida nurses are liable for the mistakes that they have done. And it's like, immediately what they did was they got rid of them. They fired them, and it was a few of them that got a lawyer. I think it was some travelers that got a lawyer and was like, well, you can't fire us because we blah blah blah. And it's like, if you one of those nurses that paid for your degree, And I mean, we all pay for our degrees, but you know what I mean. You literally paid and didn't go to class, and you passed, and you got a degree, and you got the information to pass NCLEX. There's no way that somebody is going to hire you when you didn't go through the blood, sweat, and tears of nursing school. But people found a way to wiggle their way in. It was so crooked. It was happening for some time, and it's terrible because people got fired and people got sued. It's ridiculous. So do your research on your schools. Go to school. Obtain your degree the right way, because employers are asking for transcripts. They're asking for the name of stuff. So, like I said, if it's a school that just popped up and they're doing all of these little advertisements of you starting your school and they have no accreditation, it's some places that want you to be an accredited school, especially hospitals. If you don't have that, you wasted your time and your money, and you still not working as a nurse. Do the right thing. Okay. My years and years of my own experience in many specialties makes me one of the best MPs for catching medical illness. Looks like medical, probably mental illness. Looks like a mental illness or that complicates mental. You know what? That's awesome to hear, because it's so many people that just want to fly by and just do whatever to get the bag, but you got to work for it. And when you work for it and you got time under your belt, actually, my first name, my last name, tell me how long you been an MP. Um, when you work for it and you're earning your keep with that degree, it's like you get paid your worth. You literally do. Travel nursing is always going to be there. Travel, you weren't getting paid as much now. Like, I mean, when I did case management, I mean, I was making like 4 racks a week, and it was beyond my 50 miles. So my take home was like 3,500. Um, when I worked at in oncology, I would bring home maybe 2,500, a week. Nowadays, these contracts is like starting at 2,000, which is so low. I just needed to go back to regular staff because I needed to do some things, and my husband and I are trying to do something. I'll tell you further down when that happens. Y'all will be the first to see it. But we haven't told anybody about it either, even our kids. But we're in the process of doing stuff, and I need to have a stable income. And with traveling, it's not stable. Agency is not considered stable. So, what I will say is do your part. You don't always have to do a job to get the bag. If you want to get the bag and you don't have the heart for nursing, look something else up. Okay? Google something else. What else is a high paid job with 2 years of schooling, or a high pay? You could Google that. You could put it in YouTube. It doesn't always have to be nursing. I'm tired of seeing nurses that are at the bedside with your loved one, because if it's my loved one, I'm there. Okay, it's my family is consisted of nurses and engineers. So when somebody is down, we there. If we know about it, we all up in there, and we given the right terminology to ask what's going on with this person, what's this level, what's that level. When something happens to my brother, he called me like, hey, I'm here, what should I be asking? Especially when I was traveling and I couldn't come right there. Okay, well, you need to be asking what they doing, what level is this, why are they doing this, what are they doing, what are they doing to help you, what's your turnaround time, blah blah blah. Because the non-medical won't think like that, but it's like this for people that already know the lingo and what to do in that scenario. But anyway, anybody else have any questions, comments, concerns? I don't think I see any more of my chats. I don't know if I need to refresh this because my chat stopped. So let me refresh really quick, and hopefully I can see if I missed out on something, because the last thing I saw was a hi. Let me see. hit refresh. Hopefully y'all that's watching are liking the channel and already subscribed. Oh, I'm missing so many. Okay, I'm sorry. So let me get back to. Okay, so yes, I've missed like 10 comments. Okay, you're right. So many healthcare facilities closed during COVID. There were big layoffs, no certainty um, about things when they open back up. Yes, so that's why my first name, my last name, that's why I kind of was like, no, I'm not doing it. And I should have pressed forward because I still think that I would be a good MP now. But I probably wouldn't be where I am now to where I can apply for the hospital that I'm at to get in as an MP there and be, get paid my worth. So I had to go through where I am. I mean, what I went through to get where I am now. Okay. Let's see. Yes, I think in-person practice for new nurse practitioners is important. Yes, as being an RN before and getting the MP training, 100%. Sorry to be hogging so much time. I'm going to get quiet here. No, you're not. I enjoy that interaction. That is why I'm live, because I like to interact with subscribers or the audience, even if you're not subscribed. I like to interact. It's like we sitting down having a little chit chat in a way. Okay. As a patient, I like MPs better than MDs. I feel like an individual instead of a diagnosis. 100%. My daughter actually, because she's in her second year of college, so she has an apartment now that's in a different city from me, that's maybe close to an hour away. So I said, you need to establish care with somebody. So we went on the website while she was back here, before she moved up there. And I said, well, what you need to do is you need to look and see who's available. And there were NPs. I said, pick an NP because they will actually look at you, at the whole part of you, well rounded, instead of just looking at one or two particular things, because it's nothing against doctors. I work with some amazing doctors, but nurse practitioners look at things a little bit differently. We look at you as a, like you said, as a person, not just a diagnosis. So 100%. That's what makes me. I don't know, y'all. I said on the other video that I was going to go get my master's in education, but I don't know. I need to see. I need to see if I really want to go back for my NP. I do have classes under my belt that I probably could transfer somewhere else, but I really gotta do some research within to see what I need to do. But yes, I think NPs are better. Of course, they have to listen to the MD. They're under an MD depending on where you are. But I think they're more caring to their patients because of what they did prior to. Okay, LPNs are obsolete here. Oh, hmm. You know what? I wouldn't say that they're obsolete here, but they're only subject to. That's my dog, Winston. MPs are, I mean, not MPs. LPNs are only subject to certain areas, but they started opening up hospitals again in certain departments for LPNs because it was such a nurse shortage. They couldn't wait for RNs to come through. They said, well, look, we need somebody to help. So let's open it up for LPNs, which is good because I believe that everybody deserves to be able to work into the hospital like they did before, because they did take all LPNs out of the hospital and threw them in, not threw, but they put them in skilled nursing facilities, long-term care, home health, that type of deal. And they weren't in the hospital at all. They just totally wiped all of that out, which is unfortunate, but they're opening it back up in Michigan. Okay, the juice is so yummy. That's my favorite part. I don't get what you mean. Um, that's so scary. I love your channel. Um, Thanks for your time and info. My break is over. Okay, Stem. Hopefully you subscribe to the channel. Thank you. I appreciate your our communication, our conversations. Enjoy the rest of your day. Okay, any advice for nursing students with families? Okay, so I was a nursing student with a family. When I was in nursing school, my two oldest were actually in elementary. My little one was non-existent. I was dating my husband, so he was a boyfriend back then. He didn't live with me. It was hard because I was a single mom. I had two kids from a previous relationship. Their dad was nowhere to be found. But his parents helped. So what I will say is when you're in nursing school and you have a family, whether you're married, whether you have a boyfriend, whether you have a girlfriend, and you have children, make sure that you have some type of support, because you're going to need someone to help with your little ones when it's time to study, when it's time for you to go to clinicals, when it's time for you to be focused for your test. You need that foundation. You need that help. You need. Clinton, I can hear you. You got to be quiet, okay? I'm almost done.
You're almost done, so I could get my.
Yes, just wait.
My necklace.
Yes. You got to have that when going into nursing school because it's difficult. You cannot do it all on your own. If you have a significant other, sit them down and say, hey, it's going to be tight for the next couple of years. Or if you're going in for LPN, it's going to be tight for a year. Or if you have cousins or close friends that can help you to unload some of that pressure of what you're doing for your family. And I'm talking preferably for kids, because the kids need you. And my kids, they understood that I was in nursing school. They also knew that we couldn't go and do all of the fun stuff that we were used to doing beforehand. But as soon as I got done, I'm telling you, we went to Disney World and we all went, and it was my first time, their first time, and we had a ball, okay? We had a good time because I wanted to treat them, because they had to deal with mom not really being there as much as she is used to, because my head is in the books or I'm in the library studying. So I was there to help them with homework, but my girls were smart, so they didn't need me as much. But you definitely need somebody there to help you through that journey, because it's not going to be easy. You're going to learn nurse judgment, or you're going to learn how nurses think in school, but you're really going to key in to what you need to think about and how you need to react as a nurse when you're working on a job. So that's my advice. Make sure that you have somebody there to help you if you have children, or sit down with your significant other and just let them know, hey, it's going to be difficult. You know, we can't do all of what we used to. Give me a little bit. When I get done with this, we can go back to normal or even better. Okay, you are completely right. I have a lot of doctorate programs are not accredited. Even a master's program at the school is accredited, but they are already advertising. You really do know a lot. I try to know a lot because, like I said, I'm a researcher, and especially if I'm on a channel where I'm trying to tell people about nursing and I'm supposed to be nurse savvy, right? So I need to know some stuff. Of course, I don't know everything, but I love to do research. I really do, especially if it's something that I want to get into. So thank you for that. Okay. Choosing high paid job was my worst mistake in my life. Can't do anything else but work. What did you choose, HRJ? Okay, you cannot get an NP license without an accreditation. Oh, well, that's good. That's good because you probably have to get your, I don't know if it's called a ATT, like for your RN, but you probably have to get that authorization to test form. Um, and you probably won't. Okay, so if your school isn't accredited, that's good to know. So, um, that's something to chew on. Like if your school is not accredited, you wasted all that time, master's degree, for you not to even get a license. And of course, the schools won't say if they're not accredited, right? They're going to say they're in a process of. So, you know, it takes time. So I'm glad you said that. Thank you for that. Okay. LPN for 10 years, RN about 26, and NP for 6. Nice. Okay. They'll never be able to compensate me for all I've learned during that time, but my patients benefit, and some really appreciate when I can help them better. Nice. Um, Maybe not 26 of the RN. That was a slap of the pen. 22 years as an RN in several specialties and diabetes education. Have taught some deadly illnesses with my psych patients. Nice. That's good to know. I know you know some things. Okay. Hi, my name is Navid. Say my name, please. Navid. Navid. I'm not sure, but I said it 3 times. Okay. Pediatric MP makes good money. You would do great. I love kids. I really do. The juice on the can of fruit. Oh, yes, this child love. She will. I used to pour out the juice, um, but her, she was like, I want to drink it. So it's what it is. Hold on, and said you didn't know why people would drink it like your daughter does. It's the best part. It probably is. But I always poured out the juice. Even like if I got a can of pineapples, I would always pour out the pineapple juice. Or if I don't think I've eaten any of those peach things, I would get applesauce. I would just drink the applesauce. No spoon. Just drink it. Um, but she all preppy. She gotta have a spoon. So
That's disgusting.
what? Drinking the applesauce?
Yes.
You drink the juice of peaches.
I don't even.
That's not nasty.
I don't even drink. Are you almost done, please?
Yes. Can you stop interrupting?
I'll give you 1 more minute.
1 more minute.
Yeah.
That's why I do this when you take your nap. Throw this away.
I'll give you 1 more minute to finish, or I'll give you 10 minutes.
Okay. Thank you. Thank you so much.
I'll give you 10 minutes.
Anyway, anybody else have anything to say before my daughter boots me off of this live stream that she's usually taking a nap for? I appreciate everybody that has come on here. I really, really appreciate it. Thank you. God bless you as well. I will, if you have, what I'll say, if you have any type of, because this is probably towards the end, if you have any type of subjects you want me to talk about on my next live, let me know. I tend to do lives every other weekend. I tend to do them when nobody is in the house and when baby girl is asleep. Now that my husband is at work, my 2 oldest daughters are in college. It's a little bit different because I have more quiet in the house. So, but I tend to do my lives twice a month. I probably will do more videos of just like my longer content than shorts. But I've been doing lives because I like to interact and see what you guys want to talk about. And I usually talk about it right then and there. Okay. Watching from Nigeria. Hey, Destiny from Nigeria. Okay, but if it's nothing else that you guys want to talk about, I'll give you maybe another minute if you want to type it in. I'm still available. That girl don't own me. She ain't gonna push me into doing nothing. You know, kids are bossy. Anybody else want to say anything? Go have a seat.
I got 9 minutes.
What? You counting down? She said I got 9 minutes, y'all. Lord.
Yes, you got 9 minutes. If you're done.
What? Is Ginger over there trying to get in the... Is Ginger in the window?
I don't know. Let me go.
Go look and see.
She
Oh,
was in
she
the
was.
window.
She was in the window. Okay. Watching from Belize. Nice.
Hey.
You work with animals. Nice. My daughter, my oldest, wants to be a veterinarian. She loves animals. She says she wants to, um, she rather be around animals than people.
And people?
Her cat is actually in my window.
But I want my
Hush.
sisters back.
I know they just went to college. Now this little one is all pouting because her sister's just going away and they're not at home anymore.
I'm sad.
It's
want them
okay.
to come back.
But they have to. Anyway.
I don't want them to go to college and learn. I want them to stay home and learn.
Okay, anyone else have any questions before I end this live? And hopefully everybody that's watching this subscribed to the channel and gave this video a like. I don't think I've seen anything. Let me see. That would be nice work for her to know. Keep it up, save animal life. Yes. Nice. Can you stop doing that? Because you twirling something and you just lost it.
No, it's right here.
Okay, don't do that over here because I don't want anyone to get hit, including me.
Can I just stretch it? Please.
Okay, you're right. You can't take boards without an accredited school, and that school has to meet requirements as to courses, clinical hours. Yeah. Well, with some jobs, what I was saying, with some jobs, they won't even hire you if you don't have an accredited school. So all of that time that you spent in school is down the drain. There was a quick story before I end this live. There was a when I was a brand new nurse working in the ER, there was a tech that was not the nicest. She tried to just kind of like shun me or whatever because she thought I was just, gonna be a tech under her, which was fine. She said some things and I didn't agree with it. So I asked, can I have another preceptor? Now this is during the time that I was studying for my NCLEX, but I wanted to go to the ER, but I said, well, let me see if I can just work as a tech while I'm studying and then transition into a nurse. During that time prior to, I was a lab courier, so none of that was nursing. Before that, I was a phlebotomist, but I couldn't be a phlebotomist in nursing school, so I went as a lab courier, worked afternoons after school, and I wanted to get out of the whole lab so that I could get over into the nursing area. So I got the position as a tech, but I knew somebody over there that was a nurse. So she said, well, hey, apply for this. My boss is going to interview you, hire you, and when you pass boards, you'll work as an RN. So that's why I did that. But with the young lady that was precepting me, she go, because you playing around and I told you not to. Go.
Can you hold it for me?
No, please go.
It looks like a cat toy bracelet.
Okay, so she didn't do her best. Thank you. She didn't do her best on being a helpful preceptor. So I went in and I said, well, can I have someone else? And they were like, well, what's going on? And they said, oh, maybe it was the preception of, but what they told her, she didn't know. And I didn't come in there saying, oh, well, I'm done with nursing school. I'm just waiting for my opportunity to test, because I didn't take boards right away. I wanted to wait and study. So I didn't say any of that. But when we were in the office and they said, oh, well, Sheena is and she's graduated nursing school and she's trying to she's working here for a little bit as a tech, and then when she passed boards, she's going to work as an RN. That right there, I'm telling you, when that happened, that tech, I'm not going to say her name, she was like, oh, I didn't know that you were a nurse, that you were going to be, for your graduate nurse, that you were going to be, an RN soon. Her whole demeanor changed. She just thought it was a little black girl that was going to be attacked, that you could just do whatever. No, I'm going to be delegating to you pretty soon. So you need not to treat people like that. You never know what somebody's background is. You never know their story. So I said this to say you reap what you sow, right? So as she's doing some stuff, right? Now she's trying to get into school. The unfortunate thing, and I don't wish this on anybody, but you treat people the right way and good things happen to you. She didn't treat me the right way. She was going, I'm not done. Go upstairs.
Can I draw a face on this?
Go upstairs, because you're interrupting me. And that's rude. And you cannot draw a face on that. That's a toy. It's a face already on it. Anyway, y'all. Sorry. This is why I do this when she sleep. So, you do good unto others because you want it done unto you, right? So, while this lady is trying to go back to nursing school, she's in a nursing program, guess what happens? I want somebody in the comment to tell me what you think happened. She's in the nursing program. Something happens bad. What do you think happens? Somebody say it in the comments. It's quite a few people in here. Y'all can say, you doing somebody wrong, right? Now it's your turn to get into nursing. You take your classes, and if something bad happens in school, what do you think happened? I'm going to wait for a couple comments. Come on now. Don't be shy now. How long have I been in nursing? I've been in nursing for 8 years. Is it 8 years? 9 years. I've been in nursing for 9 years. Yeah. Failed out, question mark. Anybody else? She ended up sick under your care. Anybody else? No, don't retract that. Robert, that was a good scenario. That was a good comment. Anybody else want to put their 2 cents in on what happened to her? Anybody else? I want to know. Do y'all know what happened to her? Now, she treated me unfairly. She just thought I was just this little black girl that was going to be attacked, she was going to delegate all her stuff to, and she lied. She lied about what she said, and when I brought it to the manager's attention, they were like, well, maybe the perception is off, and I'm like, no, you said this. I don't like nobody lying about me. Don't ruin my livelihood. I don't care if I'm a tech, a nurse, educator, whatever, a NP, a clinical nurse man. I don't lie about me. I'm being upfront, and she lied. Anybody else? Let me see. Darn, I went looking for the subscribe button and missed it. Whatever the scenario is. Okay, so first name, last name. The scenario was when I went to the ER, I was a graduate nurse waiting to test for the NCLEX. There was a tech there that was precepting me. And when she was precepting me, she wasn't nice. She was lying about certain stuff. And when I realized I had like 6 weeks with her, or they didn't give me a lot because I was testing for my NCLEX. So as soon as I was done with my NCLEX, the next month I was converting over for an RN position. But she didn't know any of that. So she was lying on me. She was saying certain things. And I'm like, well, can I get another preceptor? Because I still had to deal with her for some weeks. And when it was brought to the charge nurse's attention, they were like, oh, well, she's a graduate nurse. She's just waiting to test for her NCLEX. So once that happened, she was like, oh, you're done with nursing school? You're just waiting to test? Her whole demeanor changed when she realized that I would be delegating orders to her to do patient care. And she just thought I was just somebody that she was just going to, give orders to, and you lied about something. And I'm like, no, we're not gonna lie. So, the charge nurse was like, maybe the perception was off. I'm like, yeah, but I want somebody else because I'm trying to learn this area temporarily, and you lying about what you said for me to do and I didn't do it when you never said anything. Don't do that. Don't ruin my livelihood and don't ruin my job here that I'm trying to get as a RN. So now she's in nursing school. And what I said was, guess what happened? And I wanted people to comment below what they think happened to her, because you reap what you sow, right? You do good unto others, good things happen. You do bold, bad things happen. So let me look in the comments and then I will tell you what happened. Okay, she ended up sick, ended up in your care, or ended having to come up to you for school advice and guidance. Okay, she got rejected, lost her position, and was socially exposed. She got caught in another whooping lie, and it became clear that you had been right all along. Usually, you won't be supported right off. They will support her, but maybe it came back to bite her in the ended up being her boss, or at least one who delegated to her later. You wouldn't want to learn from somebody that cold anyway. She was lit into by another preceptor. Those psychopathic bullies are the kind that do things like steal patients' medicines and fake their vital signs. Ooh, I can't stand that. Ooh. Or just mistreat their patients. Okay, so what happened? While she was in school, her school closed down. Okay, she was in the middle of nursing school. Her school closed down and they didn't even tell the students. They got notified after the school closed down, I believe, or was it, if it was notification, it was like minimal, like a week before. And guess what? The credits weren't transferable. So all that time and that money that she decided to go to nursing school for, that school closed. And it was a couple of techs that was in there that I worked with. And I worked midnights. They worked day shifts. So I didn't have to interact with the one that precepted me. Once I was done with my preceptorship, I was on nights. That school closed down. And if they decided to do anything with nursing, they had to start off from scratch. That's why you do people right. You do good by people. Because when you lie on folks and you do wrong by them, it comes right back. But I'm going to end this live. Hopefully y'all subscribe to the channel. Y'all gave me a like on this video. I will keep the video up for those that have not seen it, because I have several thousand subscribers. So I want to make sure that everybody gets a chance to see this. And then if you want to talk about something in particular on the next live, feel free to comment in comment below or comment in the video and just say, can we talk about this, whatever the title is, or whatever it is on your next live. So, because sometimes I don't remember everything that goes on in these lives, but I want to make sure that if it's something that you want to discuss, we'll discuss it in the next live. Okay? So, thank you so much, guys, for sticking around with me, talking with me, commenting, liking, subscribing. This little mini hater over here interrupting our live and giving me 10 minutes to talk as she's bombarding me with snacks and candy and all of this stuff. But you know you gotta love your babies. So I'm gonna say bye now. Bye. Why are you screaming? Look, sit down and say bye. Right here. Say bye.
Bye.
Oh, Lord.